It's a lovely sunny day at the University of North Texas. A young girl and her mother were walking one evening to the Union when all of a sudden a magnitude 6 earthquake caught them by surprise. Both the mother and her daughter fell to the ground. The young girl fell on the lateral aspect of her knee among the femoral condyle and tibialis anterior. The mother helped her up, but she was unable to ambulate and bear weight independently. It was at this moment they decided to visit the local emergency department to see a healthcare provider. Among the review of systems, the patient was experiencing erythema, myalgias, and mild edema. According to the sphygmomanometer, her blood pressure was normal with a systolic of 122 and diastolic of 84. Could the diagnosis be a patellar fracture, meniscal tear, or even a cruciate ligament tear? In result, what could be the prognosis? Tune in and find out what's next.
Hello, my name is Josue Bustos. I'm the MA here. Could you tell me a little bit more about what happened?
We were walking when that earthquake just caught us completely off guard. She was trying to keep her balance, but the shaking, it was just too much. Her knee twisted and she just collapsed to the ground. I don't know if this is relevant, but she's torn a ligament in the past and she's had other acute injuries, so I'm concerned this is going to be a chronic trauma. Also, her father has had a family history of osteoporosis, so I'm not sure if that affects the diagnosis.
Alright, I think I have all the information I need. I'm just gonna let the doctor know about everything that happened and then she'll be right with you.
Alright, thank you.
Yeah, sounds good, thank you. Hey, did you feel that? I think there was like an earthquake or something.
No, I did not feel that earthquake.
That's weird. Anyways, I have a 12-year-old female patient who entered the ED complaining of lateral right knee pain, onset 1 hour ago. The patient was walking at the park accompanied by her mother when all of a sudden an earthquake occurred and caught her off balance.
Are you okay?
That caused her to fall on her right side. An abrasion was found on her posterior aspect of the elbow. Could we possibly order an x-ray or CT scan just to assess for sprain, fracture, or any further ligament damage? So she's non-ambulatory. Other than that, the patient has no other complaints at this time.
All right, let's go ahead and go examine her.
Hello, my name is Dr. Amar.
Do you have a diagnosis? Do you think she tore a ligament again? I've read somewhere that MRI scans can check for that. Is that part of our next steps?
I understand your concern, so let's go ahead and discuss diagnosis. It says here that y'all have a family history of osteoporosis.
So I dance, and I'm really prone to injuries. I'm really worried this trauma is gonna give me chronic symptoms.
Let's go ahead and check for any fractures with our x-ray and also make sure you don't have any contusions or abrasions.
On the examination of the knee, the medical assistant assessed for chondrodenia along with indications for meniscitis. The patient expressed pain along the lateral femoral condyle, which radiated toward the patella. These 3 knee examinations ruled out osteomalacia and chronic osteoporosis. Of course, an arthroscopy can be done to visually examine the knee of any lesions. The diagnosis based on examination is a mild knee sprain with limited range of motion.
Go ahead.
Do you think I'll need any therapy or medications to help with rehabilitation?
Oh yeah, can you help us with getting any medication, or do I need to consult our primary care provider?
I will go ahead and prescribe you with hydrocodone 325 mg if the over-the-counter medications are not treating the pain. Tylenol and Motrin, which are NSAIDs, these should help with the pain. But do rest, apply ice, compression, and elevate. If your condition worsens, come back in and we'll go ahead and schedule you for a CT scan. Just be sure to put no strain on the injured knee.
In this scenario, the patient is diagnosed with a mild lateral right knee sprain. The patient's parent describes how an earthquake causes her to lose her balance, fall, which created a dark contusion with mild edema. The knee is also known as the patella. It is considered a synovial joint cavity, which consists of bursa, articular cartilage, and ligament. After ordering x-rays, the fracture was ruled out and there were no tendon damage. The recommended treatment is to stay off the knee if possible, and also to rehabilitate the knee with knee stretches, and also administer NSAIDs for pain as needed. If pain continues, please follow up with the PCP.
If your condition worsens, come back in and we will go ahead and schedule you for a 325 mg if the over-the-counter medication. Should I say OTC or over-the-counter? I don't know which one I should.
You know, lose her balance. Bro, I messed up.
2.
Wait, where's my line? Sorry.
I heard that you could tear a ligament. I'm sorry.
3.
Wait, do I say the whole thing now? The pain, but if these do not, no. Tylenol, Motrin, or Bayer should.
Bear.
Fair.
2, 1.
I will go ahead and prescribe you.